To the Ruby Princess fiasco, and 4 more deaths overnight take the cruise ship-related toll now to 12. But as a criminal investigation gets underway, the fate of the cruise ship's crew still remains in the balance.
March 19. Nearly 3,000 passengers are allowed to freely disembark from the Ruby Princess in Sydney, despite some carrying COVID-19 symptoms. More than a quarter of Australian COVID deaths and more than 10% of all cases can be traced back to that fateful decision. A decision that may prove criminally negligent.
This inquiry will definitely need to look at whether or not the company were truthful and disclosed all the risks on board the vessel.
But as the Ruby Princess docked at Port Kembla today, more than 1,000 crew from 50 countries were still stranded aboard. At least 16 confirmed cases among them, with 200 showing symptoms. Authorities are now proceeding with caution.
Taking sick crew passengers off at sea is a complex and dangerous task. We will continue to sensibly take off small numbers to ensure that no one's life's in jeopardy.
But locals are fuming at the state response.
Why you would move a ship full of sick people away from 3 or 4 of the best hospitals in the country down to a regional hospital?
We simply don't have the capacity in terms of ICU beds. It's appalling, and it's all about out of sight, out of mind for this government.
In West Australian waters are similar stories playing out aboard the Artania. 26 of the 400-strong crew were transferred to quarantine in Perth on Friday. 4 have since been hospitalised, but the Premier is far from sympathetic.
I just want the ship to leave, sail away, never to return, hopefully.
More than 50 passengers and crew have been brought ashore for treatment. And while the plight of these cruise ships is complicated, our obligation to their crews is simple.
There's a whole heap of international law that applies to situations like this. The kind of core obligations that Australia has is to look after the safety, the health and well-being of the crew.
Dean Summers is the National Coordinator for the International Transport Workers Federation. He joins us now. Dean, more than 1,000 workers, as we pointed out there, some of them ill, now seem to be getting treatment. Are you content with that?
Certainly not, and we are joining the groundswell of support for this ship to be brought back into Sydney, back into the International Cruise Ship Terminal, which is really well organised and well suited to have this ship locked down. We want to have everybody tested on board that ship. We want to understand how big this problem is, triage it, send those people to hospital that need to be sent, those people that need to be isolated, send them to isolation, and start a process to send everybody home by plane.
So let's get this clear, Dean. You'd actually take people off the Ruby Princess. I mean, given that this ship has become the symbol of everything we did wrong when 2,700 people got off in the middle of the night, surely it'd be better to treat the crew, and we should look after them, on board and let no one get off that boat.
Well, for obvious political reasons, that ship's been taken away from Sydney and put next to a coal loader down at Port Kembla, completely behind the terminal there. Nobody can see it. It's hidden away, and it's a police operation. This is a humanitarian deal, and it's a big, big problem. It's not going to go away. Those people are still going to be needed to be treated, and we say treat them with dignity and respect. Do it in an organised fashion, lock the area down. The area in Sydney is a maritime security-related zone, so that can be locked down very, very easily. We're not purporting that they'd be let out wandering around the streets. These are young men and women, workers from 50 nations. Could be easily our kids, our sons and daughters, out for adventure, and now they're caught up in this and being treated terribly by the Australian government.
But treat them on the ship, surely.
Well, it's been described as a hospital ship. I don't know any hospital that's got 500 or 1,000 people just waiting to see when they're going to be sick. This didn't work in Japan. It's not going to work in Port Kembla coal terminals.
Dean, when you say you wouldn't just have them out wandering around the streets, obviously that is the plan, but can you understand the nervousness people have? Because I'm sure that, you know, with hindsight, we wouldn't have had thousands wandering around the streets the way they were. Can you see why people are so nervous? Why the hesitation?
I can see that, and I can understand that and appreciate it. But we're talking about 1,100 young men and women out working on this ship that's been servicing the Australian coast for a very long time. What I'm saying is, under very strict controls, get those people to hospital that need to be treated, get those people completely isolated from community and from everybody else until they've gone to a period where we can safely put them on aeroplanes at the company's expense and send them home to their families.
Does the ship have a home port?
No, it's a flag of convenience ship. It's registered in Bermuda, and that means there is no home port. And when politicians say send it back to its home port or where it come from, these are just tax havens. So that's not going to work. They have to understand the industry before making people's decisions or decisions for people's lives. This is a humanitarian crisis that we warned was going to happen. We're not consulted along any part of this process, even though we directly represent all of the workers. And there are 15,000 others around the Australian coast too, so it's not just the Ruby Princess.
I imagine it's really hard to get that number of people home anyway. Do you have any idea how long it would take for this process to play out?
No, I don't understand, but I do know it's a huge logistic ask. The alternative is just to push them aside, push them out of Australian waters on ships with known contagions on board. That's not the answer. And we can't afford to do that on a humanitarian, and we shouldn't be able to do it from an international maritime organisation perspective either. Each worker under the Maritime Labour Convention has a right to immediate medical treatment. I understand they're getting that in drips and drabs down in Port Kembla. But surely other people can understand to bring all of these ships around the country alongside, manage the problem, get in front of the problem rather than keep on trying to have a police approach to this and justify a political objective.
Fairly safe, I think, to predict that people will be watching this one quite closely, Dean. Thank you very much for your time.
Thanks, Waleed.